Hello, my name is Dr. Dominik Nischwitz. I'm specialist in biological dentistry and ceramic implants. Everybody calls me Dr. Domi. This video is about the shortcut concept developed by, or according to Dr. Ulrich Volz, which is in essence the removal of all root canals and immediately implantation of ceramic implants. I've seen in groups on Facebook and on the internet there's a lot of misconception and nobody knows exactly what we're doing. So if you extract a root canal, or any tooth, any dead tooth, because we don't extract regular teeth, then your body leaves a socket. This socket has to heal by itself. And over time, what we have learned in dentistry is that we have to wait and then 3 months later open up and place the implant. For an immediate implant, we use the extraction side because there's a hole anyways, the socket, and implant a ceramic implant. Ceramic implants have there are some critical aspects because ceramic implants only osseointegrate in absolutely healthy bone. That's why we're totally having protocols in place that the socket, after extracting a dead and toxic root canal, will be cleaned to the fullest. We use ozone, we use neurotherapy, APRF, everything you name it, and pre-surgical protocols, so that the ceramic implants is actually like a plug into the socket. I call it the perfect socket preservation or the perfect socket seal. Nothing is better than that. If it's possible to extract the tooth and immediately insert a ceramic implant, nothing is better because the implant now acts as a plug and stabilizes bone and tissue. And mostly in the aesthetic part, it's very important because if you don't stabilize, everything goes away and you have a huge problem because sometimes it takes you like 1 year or 1.5 years longer to rebuild the lost bone, because if you don't use it, your body loses it. Meaning, just extracting the tooth, do nothing, your bone will collapse, and also the gum with it. This is extremely critical, of course, in the aesthetic area, but also in every case. If you can remove a tooth and implant at the same time, you save time, you have probably no pain, you save your bone and your gum. And in the area from premolar to premolar, we're also mostly able to perform a temporary already on top, so you don't leave with a nasty hole or a nasty gap here, but with a temporary on top. Of course, it's not for biting purposes, but for aesthetic reasons and also to stabilize the implant while it's healing, because an implant needs around about 3 to 4 months to fully osseointegrate before you can use it for biting and the definitive crown work. So ceramic implant or immediate ceramic implant, and I'm doing around about 600 to 1,000 ceramic implants a year. 80% of those are immediates. So if it wouldn't work, I wouldn't do it, of course, but it works perfectly with the right protocol, which is cleaning and disinfection and searching for it. There's another very important point. If you do an immediate implant, you mostly drill on top of the root of the tip, and that's where you find new cavitations because they are developing over time on the tip, above the tip of the root, and sometimes there are huge cavitations, fatty, degenerative, osteonecrotic bone surrounding these root canal teeth. And if with an immediate, you always find them. And secondly, if you don't clean it perfectly with ozone and everything and piezo surgery, the implant won't osseointegrate. So this is the double whammy. You can actually have a healthy bone and an implant, because the ceramic implant, if it's not osseointegrated, you're not healthy at that side. To avoid that, the protocols have to be perfect. Pre-treatment protocol with the bone healing protocol, I explained it in another video. And then of course the surgical part, and if possible replace a temporary on top. And of course you as a patient have to watch over these teeth temporary so that you don't bite on them too hard for the next 3 months. So it's more like soft food allowed for the first initial phase. But then it's normally osseointegrated, and there are success rates, I would say, in the front part like 99%. And if it's more extremer in the side molar area, when you have to like maybe lift or do a bone graft immediately altogether, it's still above 96%. So it's a very, very high success rate. And ceramic implants are also made out of zirconium dioxide, which is, according to Dr. Dietrich Klinghardt, a healing stone. So if it's osseointegrated, you can totally be sure that the bone at that spot or your body at that spot is absolutely healthy. That's a very huge advantage, I would say. And also, of course, you save time, you save trips you save pain, yeah, and you save foreign material, because we're only using your own material, which is APIF membranes made of your blood, and your blood actually, and the bone we find at the spot. So ceramic implants, in my opinion, is the perfect socket preservation. It is the ideal point to implant, and of course, as a biological dentist, you use ceramic implants. Everything has to be biologically compatible. For this day, that's it. Over and out, Dr. Dominik.